안녕하십니까. 혈치과 원장 박정철입니다.
Hello, I'm Dr. Park
제가
Jung-chol, Director of Hue Dental
이야기
Clinic.
드릴 케이스는요.
Today, I'd like to share a case where implant treatment became necessary due to the issues of abutment teeth of an existing bridge.
임플란트 치료를 했던 증례인.
As you can see in the initial panoramic radiograph, a bridge was placed from number 44 site to number 46 site. However, a root fracture was observed in the number 46 tooth. Due to the root fracture, the number 46 tooth was extracted, and then implant placement was planned for both number 45 and number 46 sites. In the intraoral image, you can see a fistula on the buccal side of the number 46 site, along with noticeable swelling. The patient was experiencing discomfort due to the swelling and fistula. Therefore, extraction was performed first to relieve severe pain and discomfort. The bridge was first sectioned between the number 44 and the number 45 pontic, and then the number 46 tooth was extracted. About 2 months after the extraction, implant placement was planned. Since the ridge was quite narrow, GBR procedure was expected to be necessary. The plan was to place the implant using a surgical guide. Based on the diagnosis using the guide system, it appeared that a significant amount of GBR would not be needed. For the surgery, I made an incision instead of flapless approach. As you can see in the image of the number 46 site, there was a noticeable depression, suggesting the need for GBR. Flap elevation was therefore performed. Since an implant was already placed at the number 47 site, I tried to avoid interfering with the area. So, a limited incision was performed to preserve the interdental papilla adjacent to number 47 site. After the flap opening, it was confirmed that the bone width at the number 45 site was narrow, and at the number 46 site, there was vertical depression along with a buccolingual defect. Implant placement was performed using a surgical guide. Key advantages of guided surgery are that, even when the bone width is narrow, the implant can be positioned accurately. Especially in cases involving implant placement with GBR, the implant position can significantly influence the outcome of GBR. Therefore, placing the implant in an ideal position can help simplify the GBR procedures. For example, in order to maintain sufficient space, clinicians often have to invest a lot of effort. In some cases, a dehiscence defect may end up becoming a contour augmentation defect. That's why I believe implant positioning is critically important. In such cases, using a surgical guide for diagnosis and implant placement can be extremely helpful. As shown in the image, the implant was placed using a surgical guide. The implant was successfully inserted in this ridge in the number 45. As you will see in the surgical video demonstrating contour augmentation, the number 45 site required contour augmentation due to relatively thin bone width. At the number 46 site, the implant was placed as planned, and I thought placing it slightly deeper can result in a better outcome. You can check that in the surgical video. After removing the guide and checking the implant position, I felt that it could go just about 1 millimeter deeper, roughly the depth of one thread. So I inserted the implant slightly further. So after completing the implant placement, I proceeded with bone grafting due to the defects on both the buccal and lingual sides. Although the defects were not large, it was still a bit challenging to decide how to manage them. There was a slight concavity on the buccal side, so I wanted to perform volume augmentation, and I wanted to add some volume on the lingual side as well. This area also showed buccal and lingual defects, both of which required augmentation. When using particulate graft materials, the particles tend to scatter, so a membrane may be required, which adds complexity to the procedure. In cases with these defects, if the implant positioning is not ideal, the outcome can be bad. However, when the implant is placed in a good position, as in this case, I can choose to use collagenated xenograft, such as a-oss collagen, for contour augmentation. In this case, I simply applied the a-oss materials without using a membrane and proceeded with suturing. Since the material remained stable without scattering, I was able to complete the procedure with simple suturing. This is the post-OP panoramic radiograph taken after implant placement. Next, if you look at the CT images for the number 45 site, the one on the left shows the preoperative view. The middle image is a post-operative CT taken after implant placement and grafting with a-oss collagen. The image on the right shows the final result after the completion of implant treatment. The treatment was completed after 4 months. As you can see, a substantial amount of buccolingual volume was well maintained. Compared to arch width seen at the first visit, you can see that the post-treatment ridge width shows a noticeable increase in volume. At the number 46 site, there was a bony defect at the time of implant placement. This was probably due to early implant placement before complete bone healing. There was sufficient distance from the inferior alveolar nerve to allow for stable implant placement. The middle image shows the CT taken after implant placement and GBR. The image on the right was taken after the completion of implant treatment. As you can see, the defects in the buccal and lingual side showed good volume restoration. The surgical procedure will now be shown in the following video. This case involved a relatively narrow ridge and a minor defect, and it demonstrates how accurate implant positioning using a surgical guide can help greatly simplify the surgical process. Let's take a look at the video to review the procedure in detail.
눌러봐. 앞에 눌러줘. 펼쳐줘.
생각은 많이 했고.
바꿨죠?
네, 열심히.
오케이.
뒤에.
뒤에. 됐지?
네. 딸기요?
여기다,
깎았는데 커넥 라인이 좀 안 보이고 치아가 그렇게 시멘트할 정도가 아닌 것 같아서 일단 깎고 임치하고 만들게요. 이렇게 해놓으시면 이거는 프라운 하는 거거든요.
브라운이라는 게 해주는 거죠?
네, 지금 프라운.
네.